Hi, my name is Jessica Watson, and I am an exercise physiologist at Children's Mercy. I work within the cardiology clinic, and I assist patients and their families in developing physical activity habits and being able to adhere to those changes. Walking has many benefits specifically related to cardiovascular and metabolic health. Walking increases your heart rate and improves your blood flow while you're performing the activity. It can also improve your cholesterol by improving the functionality of your good cholesterol, which in turn will decrease your bad cholesterol. It also enhances your glucose transport system, and it can assist with decreasing triglycerides. With triglycerides, it has been shown that walking for 10 minutes after a meal can help to decrease those triglycerides. Walking can also lower your blood pressure and assist in weight management. Walking boosts your metabolism and can improve your cardiorespiratory fitness. Overall, it decreases all major risk factors related to heart disease. Performing exercise can also boost your energy and mood and assist in clearing your mind. The general recommendations for adults ages 18 to 64 years old are to get 150 minutes of physical activity every week. This can be divided with whatever works with your schedule. So throughout the week or throughout the day, however you wish to achieve that 150 minutes. It's considered moderate intensity if it takes some effort, but you're still able to talk comfortably. For children, the recommendations are 420 minutes of physical activity throughout the week. That can be broken down into an hour every day. If you are already achieving these recommendations on a consistent basis, then you can aim for a longer duration or higher intensity. Walking is an activity just about anyone can do. There's low risk of injury, and it is free and accessible activity. The most difficult part of creating this new habit is starting, so make it as easy as possible. Maybe that's setting your tennis shoes by the front door, or planning out your route before you go, or preparing your water bottle and have your clothes picked out. If you plan to listen to music or listen to a podcast, have that queued up and ready to go. Generally speaking, if you commit to just getting out the door, you're able to convince yourself to go for that walk even longer than what you had planned. So commit for going for a 10-minute walk, and then if you're able to go even longer, then that's even better. If you're not feeling up for it, then that's fine. At least you did that 10-minute walk. After a few weeks, you should find that you can walk a little further and faster, and may want to gradually increase the frequency from 5 days a week, maybe to 6 days a week, maybe to 7 times a week. Many people do well with setting goals, and you can do that by tracking your steps per day, your distance, or your time. As you note yourself improving in any of these factors, it can definitely increase your motivation. I typically discuss with patients to maintain time as a constant and then monitor your progress by what you accomplish in that given amount of time. So tracking intensity can be a useful aid in this. You can do that by monitoring your heart rate with a heart rate monitor or watch, or even counting it yourself, or also by just noting how tired you feel. So on a scale of 0 through 10, how tired was that walk? How tired did that walk make you feel? Once you feel you have progressed, you can work on increasing your volume by days per week, or by increasing your intensity by increasing your pace, or potentially the route you take that might be a little bit more difficult with you with more of an incline. If time is a barrier, you can include walking into your routine habits. Increase your steps by parking farther away from the grocery store or work. Take a walking break during your lunch hour. Or if you already go for a walk, potentially taking your dog for a walk every day, maybe just go for a little bit longer walk than you typically would. You can easily use this time to catch up with a friend, either by incorporating them and having them go on the walk with you, or by talking on the phone. There are many parks and walking trails locally, and walking creates an excellent way to explore these areas. It's also a great way to spend quality time with your family. Being able to exercise as a family helps you create accountability and helps all of you stay healthy. Getting creative while on the walk can help to entertain children. Some options for making this a little bit more enjoyable for them would be playing red light, green light, engaging in other forms of movement such as skipping or riding their bike, or playing I Spy. By developing healthy habits, you impact your social circle. So whether you discuss these changes with your friends or family, or you include them or not, they will notice you making physical activity a priority, and this will cause them to make changes as well. So not only will developing a physical activity plan benefit your health, it will impact the health of your loved ones as well. I hope you were able to gain something from this talk and that it encouraged you to get walking. Thank you and have a good day.